I'd like to talk to you about frequency, intensity, and duration. These are three words that are vital that you understand, and vital in terms of how we present program and how we actually change the brain. We change the brain by providing it, number one, with specific appropriate input. Specific appropriate input. That's really, really important. You know, we have over 3,000 different methodologies we use. And we are constantly going through a process. We're investigating new things. We're modifying what we're doing in an attempt to be as specific as we possibly can. You know, as an example, there's a form of tactile stimulation that is used by many, many of the OTs in the country. And they have this one protocol. You know, we have over 50 different tactile protocols, right? Because different kids have different issues, need different specific input. So our challenge is to determine how we can be as specific as we possibly can when we design your program. What is your child's need? What is your need right now? Then the challenge becomes, what is the necessary frequency, intensity, and duration with which we apply that specific methodology to, in fact, impact the brain? You know, the whole field of education and therapy has essentially ignored the fundamentals of neuroplasticity and neurodevelopment. You can do the best thing in the world, but if you're not doing it with sufficient frequency, intensity, and duration, you're going nowhere. And you can be doing the wrong thing and do it with a lot of frequency, intensity, and duration and go nowhere. Right? It's very important to get this right. And unfortunately, very, very, very few people get this right. You know, part of the problem with getting it right is the system and structure and economics. You know, therapists typically are funded to see a child twice a week. Well, gee, that's nice, but that doesn't fit with the realities of neuroplasticity and neurodevelopment. Twice a week, you know, what you put in on Monday is faded away by Wednesday. You need to come back in Monday morning and do it, Monday afternoon and do it, and Tuesday morning and Tuesday afternoon and Wednesday. You've got to keep that frequency coming in to, in fact, impact the brain, to, in fact, change the brain, to change the system, to change the individual. So we need to figure out specific input, what that child needs, and we need to do it properly. Okay, frequency is important. What's more important often than frequency is intensity, particularly if we are thinking in terms of the cortex or learning, anything academic, anything having to do with processing. Intensity is hugely important. Part of intensity is intention. Intention is an important word too, because intention generally means what you are taking in the information with the mindset of what you're doing with that information. For example, a lot of parents think they're doing math with their child or reading with their child or processing with their child. And your intention is to change those things. However, your child's intention while you're doing that may be to get you to smile. Their intention might be to give you one of those little shots and watch the little twitch in the corner of your eye. Right? Their intention may be to get you to stop. Right? Very often their intention is not your intention. And if their intention is not what it needs to be, the brain isn't going to respond. The brain's not going to get the information. So we needed to go in with frequency, intensity, and the child has to have the proper intention. And then duration. Now, duration is tricky. All right? Duration essentially means we have to be putting this correct information in over a long enough period of time to impact the brain. Where it gets a little tricky is generally as we increase duration, we decrease intensity, particularly if we're dealing with anything on a cognitive level. So a challenge that we have as your evaluators, as those designing your program, is how do we integrate and put all these pieces together properly? And if you will, it's quite a bit of a science. And our evaluators have a lot of experience in terms of figuring out this science, how to coordinate this for your child. Now, part of what really makes it tough for us is we try to determine from your input how much programming you can do. And based on that, we try to design the program to fit that. So we're getting the specific things we need with the necessary frequency, intensity, and duration to produce the change. If you're only doing half a program, you have just modified the program. You've modified the frequency, intensity, and duration. And very possibly because of that modification, we're not going to be as successful as we should be. So it's important, if you do not have the time you think, or the program seems too big, that you let us know so we can modify it. But there's some reality too. Some of the reality is you may need to really reevaluate what all you're doing with your day, your child's day, to see that we're getting in enough program to produce the change you want. That's a big deal. You may be doing a lot of things in the course of the day. Most of those things may not be as specific as they need to be, as organized as they need to be, to actually change the brain. There's an old saying that on graduation day, most graduates have always forgotten 99% of what they learned. Sad and true. Right? And that is because that information did not go in correctly. It wasn't specific enough. It didn't have the necessary frequency. It didn't have the necessary intensity. It didn't go in with the proper intention or duration to actually change the brain. If you've changed the brain, that information stays there. You know it. You got it. And whether we're talking about the change of the muscle tone of a hand, or the function of a leg, or the working of your eyes, or how you learn calculus, it all is dependent on those specifics. Are we giving the child the specific input that fits them, not 30 other kids or 20 other kids or 2 other kids, that fits them where they are? And are we delivering it with proper frequency, intensity, and duration, and with proper intention? Child's a participant. We have to have intention. So help us help you by trying to implement the program as best you can. Give us the input, the feedback relative to what you can do. Let's honestly evaluate, can you do enough? Do you have to change some things? Let's get this done as well as we possibly can. We're a team. And if we don't work as a team, we're not going to achieve the goals that you want. We're not going to achieve the goals that we want. Okay? So work with us. We can do this. Thanks.